Welcome to Ayurveda and Spirituality with your host, Alakananda Ma, a renowned Ayurvedic expert and a graduate of a top London medical school. She is the principal of Alundi Ayurveda Gurukula, a unique apprenticeship-style school in Boulder, Colorado. She is a spiritual mother, teacher, flower essence maker, and storyteller. Join us as we uncover the timeless principles of Ayurveda, discover practical tips for enhancing vitality, and explore the deeper dimensions of spirituality that intertwine with the ancient science of life.
Namaste. Welcome to the podcast. Today's topic is pretty personal, and sharing it is very much part of my process, as I'm going to be talking about living with a rare disease or condition, which, in fact, has been my struggle for the past, 73 years, in fact. So, the thing is that it's not uncommon to have a rare disease. In fact, 1 in 17 people live with a rare disease or condition. So the way that works is that there are thousands of rare diseases. New ones are being identified all the time. And because there are thousands of rare diseases, that is why it's not uncommon to have a rare disease. And having a rare disease affects everyone. Affects the individual, affects their family, their partner, their community. Many of these rare diseases are genetic in origin and do begin in childhood. And one of the things that we absolutely were taught during pediatrics is that there are so many rare diseases of childhood that it is not uncommon to have a rare disease of childhood. In fact, that's the importance of pediatricians. When I was within the NHS in the UK, every child didn't see a pediatrician. Normal, healthy kids, for their coughs and colds, their asthma, their whatever, they saw their GP. But pediatricians were the people who had to know about the thousands of rare diseases and be able to diagnose rare diseases of childhood. So, because there are so many rare diseases, it's actually not going to be surprising if your doctor hasn't heard of a large number of them. Uh, and generally, because each rare disease is truly rare, only affects 1 in a few thousand of the population, there's not so much awareness of rare diseases. So your doctor may not be thinking rare disease. In fact, it's an adage, common things occur commonly. Think of common diseases, we were taught in medical school. Great. Common things occur commonly. Why go to a rare disease if you can pick out a common one? Another way of saying that is if you hear hoofbeats, think horses, not zebras. I mean, whoever sees a zebra? They have it at a zoo, right? They're not clopping down the street. So as a result, a whole group of us rare disease folks, people who have Ehlers-Danlos syndromes or EDS, have decided to call ourselves zebras because, yes, we're here and we're real. A good example of not being aware of rare disease really comes in when I saw a patient recently who came into my clinic with a host of problems from asthma and severe allergies to irritable bowel syndrome, digestive problems. And I'm looking at this patient. This patient is over 6 feet tall. And I'm looking at the patient's hands, the patient's spider hands. And I'm thinking, there's a hypermobility thing going on here. And I ask, you double jointed? People who are double jointed will know the answer to that question. If I ask a patient, are you double jointed? They're like, what? They're like, okay, you're not. In that case, don't worry. If you were, you'd know. That patient's like, yes, look at my fingers. They do all these weird things. History goes on. Grandfather, catastrophic death of grandfather due to dissecting aortic aneurysm. Ding! How tall is your brother? How many people in your family are tall and lanky? Is your father tall and lanky? Ding! We've got to get you tested for Marfan's, a rare con connective tissue disorder or collagen disorder of genetic origin. That patient, oh, there were all kinds of tooth things with that patient as well. They'd had crossbite, they'd had missing teeth, ding, Marfan's. So I really want to get this patient the help they need, i.e. to see, A, to get a good primary because they didn't have a primary, B, to get connected with someone that is expert in Marfan's because every junior doctor dreads dissecting aorta. Your patient is most likely going to be dead before you even get to them. It's just a terrible condition, and it does occur in this rare connective tissue disease, Marfan's. So I write an excellent letter to the primary explaining why I want this patient to get tested for Marfan's, and we'll see what happens. But this is just because. Thank you, medical school. I was aware. I was aware, and thank you, Google, too. I could check some things out. I have an awareness of rare diseases because I have a rare disease that has plagued me throughout my whole life. And being English, I basically have dealt with it along the lines of grin and bear it. Let's look at some of the things that we were taught to watch out for in medical school. We were taught to look out for people who were malingering. What does malingering mean? You're faking it. You are faking having a disease so that you can, say, get off work or get pain medicines. There used to be loads of people who were excellent at going from ER to ER, faking renal colic so they would get pethidine. So it can be related to drug abuse disorders, opioid abuse disorders. It can be related to wanting certain benefits that you're going to hopefully get by pretending to have an illness. So you absolutely know you're not ill, you know how to fake it. That is someone who is malingering. Generally speaking, I've not seen too much in the way of malingering in my clinic because people have to pay to come here. And why would they bother? And I don't have any goodies like drugs to give out. I might have seen one or two malingerers, but very little. Another thing that we were taught to look out for is Munchausen's or factitious disorder. And this is different from malingering. In the case of malingering, the person is absolutely putting it on to get a calculated benefit, be that financial, be that leave from work, be that drugs, and so on. Factitious disorder is a deeper psychological or psychiatric problem where the patient still actually kind of knows they're not sick and that they're faking it and that they're tampering with their results, but they are trying to get more and more and more invasive procedures. And it's probably because they really need a trophy. They need some kind of specialness. They need some kind of attention that they think they can get by having some very special diagnoses and getting some very invasive procedures. We see that all the time, right? Huh? I've seen thousands upon thousands of patients, and I have seen one that I'm pretty positive had factitious disorder and had worked their way into more and more and more invasive treatments. Again, it might be just because there's not a whole lot for factitious disorder to get out of Ayurveda because we're not offering the kind of invasive treatments that they want. But the reality is that Munchausen or factitious disorder is probably much more rare than most of the rare diseases we're going to be talking about. Unfortunately, now we also have Munchausen by proxy. I have totally been through this where me and the toddler's mom were working with the toddler. I had even really had dad come in as well, that they were going through a bitter divorce because you have to have both parents sign the consent form to prevent the exact problem I went through, which is once we got said toddler off of a few foods to try out and see if they were better off of their foods. Uh, then mum was labeled in the divorce proceedings Munchausen by proxy. That was so frustrating because toddler was doing really well, except that dad would not abide by the food trials. So we couldn't really see if it was going to work or not, if dad wasn't going to be bothered to do it, because those trials only work if you do them consistently. So if you're advocating for a child that you believe has a rare disease, you are in danger of being labeled Munchausen by proxy situation, even though it's much more common for your child to have a rare disease compared to whether Munchausen by proxy is even a thing. Then there is this terrible diagnosis called somatic symptom disorder. This is just an absolutely awful thing. Basically saying, yes, you've got these terrible symptoms and it doesn't mean anything. These basic tests we've run are normal. It's you're not making it up, but it's in your head, and we've given you a diagnosis, somatic symptom disorder. This diagnosis should have never been invented. There is nothing like this in Ayurveda. Everyone is respected for their symptoms in Ayurveda, and if we can't diagnose a person with one of our list of named diseases, we know that Charak, our great sage, said there are innumerable more diseases to treat the doshas involved. We've got to treat the person. So I literally had a patient who was like, had developed the most terrible symptoms and decided to go to a highly respected clinic. I better not name the clinic, right, guys? And it was labeled, came back with this somatic symptom disorder. And we're like, what? Me and her primary are like, what? This does not fit this person. The problem is, if no one can diagnose your illness, you are stuck with Dr. Google. And when you diagnose yourself from Dr. Google, you're going to be diagnosed somatic symptom disorder. This patient tried various things. Do I have porphyria? This and this. Finally, the patient realized, oh, all my symptoms fit the diagnosis of systemic sclerosis. They got connected with the Scleroderma Society. They got connected with the Systemic Sclerosis Clinic. Every test was positive. They are a textbook picture, and they are now being properly treated, both with Western medicine and with absolutely helping as much as we possibly can with Ayurveda to help her with this horrible diagnosis of a very rare disease, which she undoubtedly has. But can you see, once, as a woman especially, once she's labeled somatic symptom disorder, everyone's going to be, now you're going around Dr. Google trying to diagnose yourself. It's just proving that you have somatic symptom disorder. There's also another like weird diagnosis called conversion disorder, in which they say you have, it's also known as functional neurological symptom disorder, where neurological symptoms like paralysis, blindness, or seizures appear without a clear medical explanation. We're not going to go into that a lot more, but it just means we don't yet have a clear medical explanation. In fact, some of these diseases are described in Ayurveda in the chapter on epilepsy. Um, Functional pain syndrome. That's another one. Yeah, you think you have pain, you have a low pain threshold. It's just normal pain, but you're making much of it. No one's going to get me on that one because I mean I'm graying now, but I am an actual redhead, and we actually have a 20% higher pain threshold than other people due to a lack of melanin. So no one's going to get me on you just have a low pain threshold, which is definitely what my dad was told. Oh, you have a low pain threshold, blah, blah, blue, blue. Another way of saying we're not going to be bothered to find out what is actually wrong with you. You have a functional pain syndrome. So, then, of course, as a woman, it's even harder for a woman to get diagnosed with a rare disease because you're going to get labeled as meno something. One of the things that I have, which is actually quite often comorbid with hypermobile EDS, is supposedly PCOS. And basically, I'm a young teenager. I complain. My cycle isn't regular. Oh, that's because you're young and it hasn't gotten regular yet. I'm a medical student. My cycle isn't regular. Oh, it's the stress of medical school. Um, a pilgrim in India and my cycle isn't regular. Oh, it's just because you're traveling. Time goes by. I've never had a regular cycle. Oh, it's your age. It's your perimenopause. And then boom, I don't have to worry about not having a regular cycle because you grow out of having cycles. And eventually, quite a while after cycles were over, I go to see an endocrinologist and I say, this is ridiculous. No one in my family has ever been fat. What is going on? She takes one look at me and she says, PCOS. Yes. Somebody could tell just by that they're so used to seeing, so expert, so used to seeing people with PCOS. Yes. So as women, our pain, our symptoms are often going to be dismissed as meno something. Menarche, perimenopause, menopause, postmenopause, anything other than the actual condition that it truly is. So I wanted to talk a little bit about a couple of articles regarding the diagnostic journey of people with EDS. Um, so these are quite recent articles because there's beginning to be in some areas a little bit more awareness of this uh, pretty rare connective tissue disorder. I say pretty rare because a lot of us think it's not as rare as you think. It's all the people who have suffered in silence for a lifetime, being dismissed. You have growing pains, it's menopause, blah, 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 blah. never gotten any help and not getting counted. So this disease or this group of diseases, especially hypermobile EDS, may not be as rare as we think. So a lot of people with EDS have had their symptoms dismissed. It's psychosomatic. And that's just, there's something wrong and you're told it's psychosomatic. Okay, I keep rolling over my ankles, but it's psychosomatic. I remember being in Berkeley where we went for our friend's wedding, and my I'm just walking along, and every few steps I fall down because my ankle doesn't ankle. It rolls. I remember with my friend Mo and Sadananda going hiking in El Dorado Canyon, and there's a segment there that is just lovely for me to run. I do love to trail run in some nice, not heavy boots. So I had a nice trail run. We came down, we went over to Chautauqua, and I roll my ankle and sprain it walking along the lawn of Chautauqua because I'm a bit tired. Like, this is psychosomatic. There's absolutely no way. You're not going to psychosomatically roll your ankles. Um, sorry. Uh, so, uh, People start to get put off of seeing doctors. Um, there's also been a lot of psychiatric diagnoses that are used, as we just discussed, to dismiss the physical reality of a patient's symptoms. Quoting from this study, our participants' attitudes towards co-diagnosis is of clinical interest because it may be indicative of their willingness to follow treatment recommendations. So what co-diagnoses do they endorse? What co-diagnoses do they reject? This is important. The issue with so many of these rare diseases is comorbidities. If you have a connective tissue disorder, like the potentially Marfan's patient that I talked about earlier on, or myself or other EDS patients, you're going to have a host of comorbidities that arise out of the weak collagen, out of the fact that your skeleton, your nervous system, your larynx, nothing is being properly supported. So there are many comorbidities, things that do arise with, for instance, EDS. People get POTS, uh, a tachycardia type, and all kinds of dysautonomias, all kinds of issues with the vagus nerve not working properly. I tend to get uh, shortness of breath that I shouldn't be getting. That could be dysautonomia, or it could be the trachea or and bronchi kind of collapsing a little bit. Who knows? It's never been looked into, right? Never going to be looked into as far as I can understand. I also get swallow syncope, which I tried telling my doctor about, and she got a little scared and said, "Is this dysphagia?" And I said, "No, I've had it for years on end. I haven't even passed out for years because I, if we're having sandwiches, I cut mine really thin. I've just had to learn to take smaller bites, and you can get it from water too, so smaller sips. It's just dysautonomia, but all these kinds of things, POTS, then mast cell activation syndrome, this is the trifecta that really goes with EDS. So a lot of EDS patients have these other diagnoses. Um, but there's another really interesting article that did come out this year itself, looking at non-psychiatrists misdiagnosing hypermobile EDS patients with psychological disorders that they don't have, which leads them to go through inappropriate psychiatric interventions while their actual illness, their actual condition is progressing with no treatment. Okay, there is no treatment. There is no treatment for a lot of these conditions, but there definitely is support that people can get by way of physical therapy, yoga therapy, different kinds of support that people can get that could help. Um, so a number of these rare conditions do also are also comorbid with autism or being on the autism spectrum and ADHD. How much autism spectrum disorders flower can depend on how that child is being treated at home, at school, by elders, and so on. And when you're dismissing a child who's in pain and misery due to being hypermobile and having lousy connective tissue, that autism and that ADHD are going to flower forth much more. The children are going to start having distrust towards medical professionals. Um, there is a huge stigma. I've lived through this. There's a huge stigma associated with mental illness. And now you're taking a lot of people who are already suffering with a rare disease, you're giving them a psychiatric label that you may not, as a non-psychiatrist, even be qualified to give. You haven't given them the extensive testing that should be the case. And now they're stuck with that stigma as well. Um, so some of the misdiagnoses that came up in this study, it's in your head, you're making it up, you're seeking attention. If the parents are trying to help you, it's Munchausen by proxy, or factitious disorder, or conversion disorder, all the things we talked about. Um, the vast majority of all the patients in this study had received a psychiatric misdiagnosis before they got diagnosed with their actual hypermobile EDS. They were told they were fabricating their symptoms, labeled as attention seeking, misdiagnosed with conversion disorder, told it was in their head, or the parents have Munchausen by proxy, or you have Munchausen. Um, so uh, it's very, very difficult. It is 10 to 15 years for a typical person with a rare disease to get diagnosed. In my own case, it's been, like I said, a 73-year-old journey of, thank God I'm British, grin and bear it, basically. Put up with it, live your life, have your adventures, do what you love to do what you're here to do, and put up with it. It's only after the health nightmare that I lived through in the last 11 months, which included two fractures either side of emergency surgery, all of which that hypermobile EDS diagnosis is definitely superordinate. It's definitely the cause of getting fractures because of lack of proprioception and balance, and the cause of having the condition that led to the emergency surgery. It all goes down to the hypermobile EDS. I started to think maybe I should get helped with this. My primary, bless her, I love her, but it was also difficult. First she said, "What is EDS?" Uh-oh. Then she said, "Well, a rheumatologist will diagnose you. See a rheumatologist." So I look around, try to find an EDS aware rheumatologist, get referred, and get a denial. Literally get a denial saying this clinic doesn't, where the expert used to work, maybe they're retiring. This clinic does no longer diagnoses these conditions. There are no longer any rheumatologists in our part of Colorado that work with these conditions, at which point I'm left with, okay, I'm no worse off than I've been for 73 years. I've lived my life. I've done what I love. I'll activate my warriorship and I'll keep going. Um, what are some of the things that help you to keep going, help you to get the diagnosis and the help that you need? So you may start out self-diagnosed. In my case, yes, self-diagnosed. Hypermobile EDS, having been diagnosed, lax ligaments, which was kind of what they said back in the day. If you're self-diagnosed, you're in luck. If you have got, if Dr. Google has helped you to figure out what you've probably got, then you can join a support group. And that's the thing that I found to be super helpful is I've joined a couple support groups on Facebook. One, the main support group for the condition, and the other is the local one and the local support group. You can get information about practitioners, strategies, ways to navigate your condition living where you live. Just knowing that you're not alone, that literally other people are going through all the exact same things that you're going through is really, really helpful, and getting that person-to-person support. Of course, if you're completely undiagnosed, you don't even know what support group to look for. Um, if you are self-diagnosed and you found a support group, there's probably also a society for your condition where there's all different kinds of layers and levels of support. If you have no diagnosis, then what are you supposed to do? Keep searching. Don't give up on yourself. It is not in your head. You are not making it up. Factitious disorder is far more rare than whatever it is you have. Keep searching. And of course, dear friends, do try Ayurveda. I've given you a couple patient stories. According to Ayurveda, there's an entire massive list of named diseases, and then it is stated that as there are innumerable people, there are innumerable diseases which have not been named. What do? We treat them empirically. Um, we can also try searching ourselves and finding our way to that rare disease that you might have. But at least with Ayurveda, you will get help. We will believe you. We will not try to give you a psychiatric diagnosis. We will believe the reality of what you're going through, and we will feel your pulse if you're coming in person, or if not, listen to everything you're telling us, determine what doshas, dhatus, subdoshas, ojas, tejas, prana are affected, and provide appropriate treatment. And you're at least going to be on a path of feeling better. And if you're like me, a detective, we're going to help you to find out what the rare disease is that you are suffering from, because there are ways to sniff it out. So, yep, don't give up. Keep searching. Your pain is real. Your suffering is real. You are 1 in 17. You are not alone. We are many and we are strong. Let's support each other. Namaste.
Thank you for tuning in to Ayurveda and Spirituality with Alakananda Ma. We hope today's exploration has ignited a spark of curiosity and insight within you. If you enjoyed this episode, be sure to leave us a 5-star review and share it with a friend. For more enlightening discussions and practical wisdom on Ayurveda and spirituality, subscribe and join our Facebook group, Alundi Ayurveda. To allow us to continue sharing valuable content, consider donating to Alundi Ashram. The links will be in the show notes. Until next time, may you walk the path of Ayurveda with grace and embrace the light of spiritual wisdom in your journey. Trayambakam yajamahe
Sugandhim pushtivardanam